The flap we're going to demonstrate for you now is the anterolateral thigh flap. And the reason for this circle of pigment here is because, like many of the flaps we've demonstrated for you, the ability to take skin with the flap is dependent on perforators that come up from the deeper circulation to the skin. This flap is based on a branch of the lateral descending femoral circumflex vessel, which in turn is a branch off of the profunda femoris artery. The one that we showed you on the other side of the thigh was the gracilis flap, which is a branch off the medial side of the profunda. This now is blood supply that comes out to the surface of the skin from the lateral descending branch of the profunda. The reason why these lines are drawn here is because if you make your access incision here, you have access either to go to medial branches of the artery or lateral branches of the artery. It allows you to take quite a large skin paddle from here, which then you can transfer for use in multiple areas around the perineum and the groin. Or if you decide to take it and harvest it as a so-called free flap, you can then hook it up for reconstruction in many areas of the body. The reason why this has become a favorite of reconstructive surgeons is because the skin of the thigh is pliable and it's very thin, which is unlike a lot of the flaps that we have demonstrated for you today, which have an associated muscle, which makes it much thicker and harder to use. But for just a skin, which is so-called a fasciocutaneous flap, you can use it for many things. We talked about the gracilis muscle with its associated skin paddle being able to line the inside of a neovagina for gender reassignation or for reconstruction following cancer surgery. Similarly, this flap has a nice wide area of thin pliable skin that could be used for the groin and perineum, even for a neophallus, for example. You could make a wide enough paddle of skin to wrap around a prosthesis and tunnel it into the groin area to serve as a neophallus. So this, my colleague Dr. Kwan is going to demonstrate the relative rapidity of being able to access the small perforators that supply this skin area. What Dr. Kwan has done is taken a representative width of skin. If we were to do this in a regular patient, we would have to graft this donor defect. But part of the value of this donor site for this flap is that you can actually close it primarily sometimes without the need for skin graft here. But when we peel this back, you see the vastus lateralis is this muscle that's right here. And the blood supply comes through, again, from the profunda femoris and then the descending branch of the lateral femoral circumflex, comes up through the muscle and then through perforators to the skin. Sometimes, when this pedicle is the length that you would like to transfer this, for example, to another part of the body, you may want to take a small cuff of muscle around this to preserve the neurovascular bundle. So again, to remind you, it's a nerve, an artery, and a vein that are in here that you can see demonstrated here. This is the nerve part, there's the vein part, and then the artery is here. You may want to take a small cuff of muscle to preserve the sanctity of the neurovascular supply. But then you can take this, transplant it to some other part of the body, and then close the donor site either with a skin graft or primarily. If you close it primarily, like in most places, especially when you're closing a cylinder, you'll end up with an indentation. But the body is enormously adaptive, and after time, that indentation, which is where we took this flap from, will gradually round back out and assume a cylindrical shape once again after a couple of years. So that is the anterolateral thigh flap. Again, a very useful flap because of the thinness of the skin and the fascia that you're taking for a variety of uses anywhere in the body where you need thin, pliable coverage.